Welcome. My name is Peter Strong. I'm a professional psychotherapist offering therapy via Skype for anxiety and depression, for addictions, for PTSD, and for working with all other forms of emotional reactivity that are common and affect the quality of our life. So we have to work at the level of those emotions. For example, anxiety and panic attacks. We have to learn to stop talking about our anxiety or panic and start to actually develop a different relationship with those emotions themselves. This is a crucial part of the healing process. Just talking about what makes you afraid, what triggers panic attacks, and trying to avoid those situations is not going to help you heal. You need to turn towards your anxiety and develop a conscious, non-reactive relationship with it. So that is part of the principle of mindfulness therapy, which is what I teach online. I will teach you how to develop that all-important relationship with your anxiety that will promote healing. You have to learn how to become the observer that can observe the anxiety as an object, and to maintain that relationship where you stay as the observer, observing that object, the anxiety or other emotion. That is critical. That's the first part of our training. It's called developing the true self. The true self is defined as that observer, that quality of mind that can see experiences clearly as they are, as objects. Another term that we often use is developing objective consciousness, which is also that ability to see an object clearly as an object, rather than subjective consciousness, where we simply react to that object with fear or anger or simply becoming overwhelmed by it. The critical thing here is to establish this relationship. True self as the observer, seeing the anxiety, or little self as we often refer to it, as the object. When you have a stable relationship like that, true self seeing little self, then you create the right conditions for healing that anxiety. And this is crucial for working with panic attacks. You have to change that relationship, because what actually happens during a panic attack is that you lose that identity as your true self, you lose that objective consciousness, and you contract into the anxiety. And we feel it as a physical contraction as well as a psychological contraction. That is the primary process that goes on during a panic attack. We lose our identity. We literally become smaller. We become that little self. And then when we do that, when we contract into the anxiety, then that basically takes away our freedom, and it starts to ignite further reactivity, which feeds that anxiety. So in mindfulness training, we're learning to break that habit of reactive identification. That's the whole point of mindfulness teaching and mindfulness therapy, is to maintain your true self identity and not lose it to the anxiety or the depression or the impulse to addiction or whatever it might be. When you have that relationship, then you can start to help the anxiety heal. So we form a relationship based on compassion with that emotion, the little self. Very much like a parent forming a compassionate, caring and loving relationship with a child that's in pain. You have to learn to love your anxiety. People say that's impossible. I hate my anxiety. And I would say, yes, that's the problem. That is what is sustaining the anxiety. That emotional reaction of hatred feeds the anxiety. People also get lost in patterns of avoidance, trying to escape any situation that might trigger that anxiety or panic attack. So that's a reaction of avoidance. Also, its effect is to strengthen the underlying anxiety. And that is counter to the teachings of mindfulness. We want to build a relationship with that anxiety, because that is the only way that the anxiety can ever heal, is when you re-establish that connection between your true self, the observer, the non-reactive entity, that is your true identity, with the little self, the emotional reaction. You have to build an alliance between true self and little self. This is what promotes healing. Then you can respond with compassion, which is about really seeing what little changes you can make to the emotion itself that help it heal. So anxiety, like any other form of emotional suffering, is inherently unstable and trying to heal, trying to return to equilibrium, to balance. Just like the body healing itself if it gets injured. It's the same process with emotions like anxiety. You can think of them as being more like a wound in the mind. Its nature is to heal. That's built in to the very structure of the emotion itself. So the anxiety is trying to heal, but the reactivity, the habits of reacting to that unpleasant emotion is the problem. That's what prevents that natural healing from occurring. So we establish a good non-reactive relationship with the anxiety, and then we help it heal. And typically, the best way to help any emotion heal is to work with the imagery of the emotion. So all emotions are based around internal psychological imagery. That is what actually creates that emotion. That anxiety, that panic attack, that feeling will have a certain kind of imagery. The chances are it's very large and very overpowering. That's in fact the reason that we say that the emotion is overpowering or getting on top of us or weighing heavily on the mind. It's because it's very large. That is a key ingredient that makes that anxiety work. So changing the imagery is a central part of mindfulness therapy. Looking at the imagery of the anxiety and then changing it and helping it heal, because when any emotion heals, it does so by changing the imagery of that emotion. Now this often happens quite naturally by itself, but when we become reactive, that reactivity inhibits healing, which means it inhibits the spontaneous change in emotional imagery that's required for healing. So during our mindfulness work, we learn to meditate on the anxiety. That's the critical part of the therapy process. We learn to hold that anxiety in the mind. We learn to build this relationship with it, where we remain as true self, observing the little self, the emotion. We then look at its imagery and we explore changing that imagery in a direction that helps that anxiety resolve itself. And so we're essentially training the anxiety to resolve itself and freeing ourselves from those unconscious habits that cause that anxiety. So panic attacks can be overcome quite easily as long as you take this approach of embracing that anxiety in the same way as embracing a child in pain. You must not avoid it. You have to start to learn to overcome the habitual reactivity to it, and then start to develop a compassionate relationship with it and look at its imagery and help that imagery change. If you do that, you will see dramatic changes and healing will ensue. Most people see quite dramatic changes when they take this mindfulness approach to healing anxiety and panic attacks. Typically, most people that I work with see significant improvements within the first 3 or 4 sessions. All my sessions are done via Skype. I find that that's more than adequate. You do not need to meet with a therapist in person to learn these methods of how to work with your anxiety effectively. So if you would like to get started with me, if you'd like to schedule some Skype therapy sessions to work with your panic attacks more effectively, then please go to my website, contact me, and let's schedule a Skype therapy session. Thank you.